do think even the idea of like newborn baby bliss is, I hear that and I'm like, does that even exist? Like maybe there's moments of that, right? But I just think like the reality is there is this piece of what do I do now? Who am I now? Right? That's inherent in having a baby. And so I think setting women up for that expectation that like you're allowed to have questions of where do I go from here, and getting that support to figure out how to be happy in motherhood is okay.
Hello. Today we're talking about something that so many women experience, but honestly, not enough of us talk about the emotional and mental journey of motherhood. I'm really excited to welcome Dr. Brittany Trauthwein, a clinical psychologist and founder of Bridgepoint Psychology, who specializes in maternal mental health, amongst other things. Whether you're pregnant, postpartum, or deep in the trenches of motherhood or parenthood, this conversation is for you. Dr. Brittany, thank you so much for being here. I'm super excited to dive in.
I'm so excited to join you today.
Can you tell us more about your background and Bridgepoint, why you started it, just the beginning trenches of it?
Yeah, absolutely. So throughout my career, I have always focused on working with grief and loss, and also clients going through cancer journeys. But grief and loss has really transformed over the years to including non-death loss or just experiences of loss, whether that be hopes of how women hoped their journeys would go, as we'll talk about in this topic, or just different life transitions. And so that has really led me to support many women who are going through motherhood, particularly motherhood in kind of diverse journeys. So I work with a lot of women who are maybe a little bit older, taking the path to motherhood, or who have not found the partner that they were hoping to find and have made the choice to be kind of mothers on their own, or helped women decide whether or not motherhood is even for them based on different health conditions or just wants and choices in their life in general, whether it's pursuing careers or other passions for themselves, but really just feeling free to live that life that they want to live as well. So a lot of the work I do is around grief and loss, whether it be for mothers or just other individuals going through different journeys. As far as Bridgepoint Psychology Center goes, I founded the practice in 2018, which feels like a while now. But really, the core of the practice was creating a practice of specialties. So I didn't want to have just a generalist practice. I think there's a lot of practices that treat a lot of diverse things, but I wanted a group of specialists who could really hone in, particularly around grief and loss, trauma, women's issues, men's issues, and supporting children and adolescents also going through different transitions. So our clinicians are all highly trained in the area that they choose and continue education in those specified areas so that people that come to Bridgepoint really know they're getting that specialized care.
Love that, absolutely. And I think, especially when it comes to motherhood, there, as you mentioned, there's not just the motherhood journey as everyone sees it, it's also that it might not go the way you planned, or it took you longer than expected to get there. So, yeah, I'm excited to dive into that later as well. Just kind of the beginning, what are some like of the biggest psychological shifts that you're seeing as someone becomes a parent, and especially mothers?
Yeah, I would say there's so many shifts that take place both emotionally and physically. And I think they go hand in hand. But I think, just initially, whether it be through hormonal changes that women experience, especially that could be before pregnancy, if they're going through like an IVF journey, for instance, or right after pregnancy, they might experience some mood shifts there. I think there's a lot of different experiences related to just societal expectations around motherhood that starts very early in pregnancy. I think most people assume that when someone tells them they're pregnant, they go right into celebrating, but they don't acknowledge maybe what might be behind that news. For many women, it's been a really hard journey to get to that point, or there might be loss that has happened prior to that, or a lot of anxiety and fear around just protecting that pregnancy. So even sharing that news might come with some stress. I think one of the biggest psychological challenges I see in women too is around the expectations of motherhood. So whether or not they want to breastfeed is a huge conversation that comes up in my office quite frequently, where there's a lot of societal pressure on what motherhood should look like or what being a good mom means. And for a lot of my clients, they might have some pre-existing depression or anxiety, and people don't talk about it often, but breastfeeding for some women is very difficult on mood. So some people experience heightened anxiety, heightened depression. It may not be an option for them from a safety standpoint. And so trying to balance that with just societal expectations while trying to also be the mom they want to be, I think brings up a lot of different just stressors kind of early on. and the
Which
need
is
for support.
so hard. Yeah, absolutely. I think we're kind of going away from this, like in the 70s, you were like, oh, formula, formula. And it's like seen as like not classy to breastfeed. Now it's like, if you don't breastfeed, what's wrong with you? Why aren't you breastfeeding? But it's a lot. It's a lot that you have to also compromise. You're constantly tied to your pump or your baby. You have to watch what you're eating. You can't just go in and work out and diet and get back in shape. And like just everything that comes with it, the pain and all of it. So yeah, I definitely understand that some people want to do it, but it's just too much. It's a lot.
I
And
think given the autonomy over your own body, I think people
yes,
forget that has already kind of been given up for so many months.
yeah,
And then to kind of commit to this, I would say what most people's standard is, oh, making it to a year. I hear that so often. Like my goal is the
yeah,
first year. And it's like that's almost 2 years of being tied to another,
mhm,
thing. And that
yeah.
comes with its own toll of just stress and identity. And, again, like you're saying, you can't make choices just for yourself in those moments.
Yeah. And maybe as we kind of talk about exactly that, you can speak about kind of this transition that mothers go through as they get into this motherhood journey, which that's kind of something that was told to me by a friend that she said, you also need to give yourself space to grieve and really grieve this, like, yes, you're becoming a mom, but you're also grieving this, like, losing this maiden life and kind of like preparing yourself for this transition. And it's not just all like rainbows and butterflies. And there's a whole thing of you that also dies with becoming a mom.
Well, and I have one client who said to me, like, the first year is really survival. She was very
Yeah.
blunt when she said it. She was like, so many people talk about, these excitements and milestones, and yes, they're happening, but really
Yeah.
you're, trying to figure out so much of how to be a mom. You're trying things that aren't working, because every baby's different and you're just trying to survive. There's not as much space to necessarily nurture yourself in that's even needed. I think the other piece on top of that almost gets written as like an expectation is just sleep deprivation and the impact that has on moms too.
100.
You're like trying to do all these things while you're also like barely awake and like not getting the sleep you need.
Yeah.
So it's hard, I think, to find that space to even want to nurture yourself. And, when you are awake, you feel this kind of guilt that gets put on you to be with your baby. But yes, I think that space of like grieving life before is not talked about, but also so important because there are elements that just are not present after you have a child.
Yeah, absolutely. So, are there certain things that you can recommend that parents can do proactively, like while they're pregnant? Because you touched on it earlier that, sometimes it's not just being just superly excited and celebrating it, it's also being met with a lot of fear. And then getting into like being a parent. Like, are there certain things that parents can do proactively to really like take care of their mental health?
Absolutely. I mean, I think anytime parents start therapy while they're pregnant or even when they're thinking about getting
Mm,
pregnant before
yeah.
having children, I think is really helpful. A lot of the work I do, especially with women who are kind of going through the pregnancy journey, is preparing them for some expectations of what might happen. Not to say that all women feel these feelings after having a baby, but I think just normalizing that if you do have them, it's okay is a
Mhm.
huge part of it so that they're not feeling the guilt of why don't I want to spend every waking moment with my baby or why do I need more sleep than I, was told I would need? Or also setting up support plans, I think are really helpful ahead of time. People will offer help, but I think if you can identify what support is really available ahead of time and how to ask for it when you need it. And sometimes it's things that you wouldn't think of. So, can we switch, which I realize is a privilege, but can we switch to delivery groceries on a week where we're really tired? And can we think about
Mhm.
how we might identify we need to offload some things we don't have time for, right? Or is there a
Yeah.
friend that would love to spend an hour kind of sitting with your baby while they sleep? So you can just take an hour to read a book at a Starbucks, right? If that's something that really good to you and might fill your cup a little bit. But I think identifying those things before a baby is even in the picture is a lot easier than when you feel like you're in the thick of it. Knowing who your support people are, having therapy kind of in place if that's needed. I also think just normalizing support in general. So I often talk about like if you have access to a babysitter or someone, again, that would help, not using it just for tasks, but using it just
Mhm.
for recovery. So can someone, again, watch a baby for an hour so you can read a book? or watch the baby for a couple hours so you can go do something for you that's not a task. Because so often we feel like we can use those resources only because we have like a to-do list to do, and there's no really recovery happening. That pre-work of just getting in that mental state of, if I take care of myself as a mom, I'm going to be a better mom when I'm with my baby, and giving yourself permission to identify when that's needed. Also getting a team in place of whatever support is for you. So maybe for some people that's also doing some acupuncture if they need some like body regulation because anxiety is really high. But just figuring those things out ahead of time, I think, can be so helpful.
What you mentioned there in terms of just like asking for help and getting help to just take care of yourself, that really landed. And that's something that I didn't understand before having a baby. And my friend told me, I just really had to get over this mom guilt of like getting a babysitter for a few hours on the weekend just to go get my nails done, just to go and just do whatever I wanted to do, to go for a walk without my baby or just do something for myself. But it's this like guilt, as you mentioned, that like, why do I not want to spend every waking hour with my baby? And then on the weekends, especially if I don't have to work, like, why do I? But we have to really be able to, yeah, come from a full cup, right? And be able to really, yeah, nurture our babies because we take care of ourselves. So that's amazing. Definitely a great recommendation. And in terms of anxiety, maybe that's something that you can speak of because like postpartum depression is always such a big topic. Thank goodness it's getting more talked about and more normalized, but no one really, or like it's not as often talked about as postpartum anxiety. Maybe you can touch on that too.
Yeah, absolutely. I think part of that we see is honestly that so many moms are high functioning, and
Yeah.
people just don't even identify that they're feeling anxious because they're doing the tasks, they're getting everything done, but it doesn't mean that that level of overwhelm or stress is not turned up a little too high. I think the other piece to that is that we're often looking for depression. Like if we go to a doctor's appointment, they're more often screening for depression in postpartum than they are anxiety. They're not even asking a lot of times the questions that might spike anxiety on a scale. So I think that's part of why it's not talked about as much. And I think there's some normalization that gets a little over normalized of people that are like, oh, that's new mom stress, or you're just worried about the baby. Everyone worries about the baby when it's your first, especially a first baby. It gets kind of written off as normal when really there are these levels of anxiety that really do impact daily functioning or make it to where life just feels so burdensome and scary that I think we're missing a huge part of that need to be treated and supported.
What are some like signals that like people, like parents, overall, also dads, I would say, should look out for when when you think like, okay, this is not the norm, like it would really benefit to get some help?
Yeah, I have kind of like a baseline question that I sometimes have, parents check in with themselves. And one is like, am I feeling mostly like myself with a few hard moments? Or do I feel like a different person stuck in these hard moments all day? I think that's like a
Mm.
really easy, just like red flag question to get someone thinking about like, is this maybe like somewhat normal or am I crossing over? And if they kind of indicate like, oh, I feel stuck all day, the things I'm really looking for are like, how intense are these feelings? How long are they lasting? Is the intrusive thoughts, especially around like anxiety, are they causing like really heightened panic around like something happening to your baby or to yourself? Are we able to leave the house? Are we afraid to leave the house? Those are some kind of things I'm looking for, where I might be like, oh, this might be crossing over a little bit.
Yeah.
We're thinking about the depressed side of things. Connection is such an important piece. If we're really having a hard time connecting to our baby or feeling kind of like, I'm not able to build this relationship, I think there's often a piece that's in there that might be a little bit more than what we're, just what would be normal and expected. And then again, just that difficulty functioning, sleeping, eating. Are we taking care of ourselves? Are we engaging in social activities that we have space for, but maybe we're choosing not to? Those are kind of some of those red flags I might be looking for where more support's needed. I still would say very normal and experienced in a lot of women, but doesn't mean that we don't need a little extra support to maybe find our way out of that.
Because also, I think that when you kind of how you mentioned, at the OB or wherever you get these screenings of like, how are you? But I think another part of that is like how honest do you want to be in that moment, because it's a whole nother step to like become aware and be ready to ask for help, because there is this expectations that you should be over the moon, your baby is here, this is beautiful, and then all of a sudden you can't create that connection, you don't feel this newborn bliss. So that also is really hard to just first recognize and then be able to be honest to yourself and ask for help. So do you see usually that like moms come to you themselves, or is it the partner, or like what are kind of like the steps usually to get help?
Yeah, I would say it's a mix of things. A lot of times I am seeing clients prior to pregnant, or either prior to
Mm,
pregnancy or prior to birth. And so I have a little bit of baseline that helps me
nice.
kind of know if something is changing. But I do get clients that have been referred directly from OBs who are kind of like, oh, I have a little bit of concern of what's going on. Or other times it's family members that will identify that they're just a little bit worried about maybe lack of engagement, or a lot of times it's kind of more withdrawal or just not wanting to engage in things that they enjoyed before tend to be I would say what's the red flags that end up in our office.
Yeah.
But again, I would say like a lot of it is normal. I want to be really mindful of that. Like, I'm not saying that I would say even that is something that is not normal in pregnancy. It's just the support piece is helpful.
Hmm.
Because I do think even the idea of like newborn baby bliss is, I hear that and I'm like, does that even exist? Like maybe there's moments of that, right? But I just think like the reality is there is this piece of what do I do now? Who am I now? Right? That's inherent in having a baby. And so
Yeah.
I think setting women up for that expectation that like you're allowed to have questions of where do I go from here, and getting that support to figure out how to be happy in motherhood is okay.
Absolutely. And there's just the societal, like this pressure, right? Of feeling that way. And then the comparison of how you mentioned the milestones and even the sleep. You feel like you hear, oh, they're sleeping through the night. Why is my baby not sleeping through the night? And that whole part, and just, yeah, finding help there as well, which I have realized is a big thing. I'm just not a happy person. I don't like my daughter when I'm sleep deprived. I cannot show up as an amazing mom if I'm super sleep deprived, because I can't go back to bed. My mind starts racing and it's just not, versus my husband, he wakes up, but he can go right back to sleep. So I just had to be honest with myself and say, you know what? I think you should take the night shift. And, I'll get up at 4:30 a.m. and I'll take over then. You get to sleep in. But yeah, just finding whatever works for you and being like, yeah, just gentle with yourself and the comparison. I think overall comparison is hard, but in that specific time, it's just the hardest when it comes to why they're crawling. My baby isn't crawling yet. Why are they sleeping? My baby isn't sleeping. It's just so much pressure on top of everything else. Yeah.
Well, and I think it's amazing when speaking of comparison too, I work with women who go back to work after having children or who choose to stay home, and neither path feels like there's less comparison, guilt, or judgment.
Mm.
Like even making that decision of is it okay to have my, child go to daycare so that I can return to my career, or am I spending enough time with my child as a stay-at-home mom if I am doing things for myself? Like either side, I hear so much judgment over, what is the right path to motherhood, or am I doing it the right way? And I just wish there was more space for women, just
Yeah.
to be the mom they want to be in whatever path they choose. But I think there's just so much guilt wrapped up in the way to do it.
Yeah, absolutely. What are some kind of like some trends that you're seeing in your industry?
And when you ask that, do you mean psychology just kind of as a whole, or more within motherhood work, or?
I would say psychology maybe as a whole, yeah.
Yeah, I would say some of the trends right now and shifts are honestly just an openness to therapy that I think is much greater than when I started as a therapist. We're seeing a lot of people come to therapy even uncertain of why they're here. They're like, I just want to kind of check in to see if I'm doing okay, or maybe see if there's some depth work that I haven't thought about in my life. And I think the stigma around mental health, especially for younger people, has gone down dramatically, which I think is great. So we're definitely seeing a lot of people that are coming to therapy compared to before. I also think there's been a huge shift in the normalization of telehealth, which has opened up access dramatically since COVID, particularly. I would say that has changed how therapy is, provided and available, and we're able to see people in so many different places now. That's been a huge shift in the field.
So that's something you offering as well now, where you don't only have local patients, you have patients US wide and are doing online sessions.
Yeah, so after COVID, depending on license, and some of us are able to cross state lines, which did open the door to start seeing clients across the US. That has remained kind of a challenge, I would say, as regulations change or different degrees can do that and others cannot. But yes, it has definitely opened that door. And hybrid sessions where some people will come in person sometimes, or, if they need to switch to telehealth last minute, they can, which I think has helped with continuity of care.
Mhm.
It's really increased access.
Yeah, it's beautiful. And I think especially in different chapters of your life, if it's after loss or in like being a new parent, just leaving the house is a whole nother hurdle that can get in the way. So being able to just do it from the comfort of your home is definitely an amazing new change. When it comes to Bridgepoint, it's pretty impressive to have a private practice. What are some of the challenges that you've been going through? And yeah, what are kind of your goals for the next year?
Yeah. As far as challenges go, I think, and probably many group practices are feeling this right now. We're just in a time where I would say like the need for therapy is higher than the availability of providers. And so we're constantly in a flow of having either, wait list for a little while or just being kind of overscheduled. Some of our schedules end up getting overscheduled based on need. And I think that's really increased just an awareness of burnout prevention that's really needed within the practice and checking in with clinicians regularly on, how are you managing the clients you have and how are you feeling with your caseload. I think some of that has really been due to the fact that we're in a time where a lot of our clients are coming in with societal stress or kind of political stress or things that our clinicians are also experiencing. And so trying to balance kind of shared emotions and keeping that separate while being the therapist for our clients is a little bit of a newer terrain. And I would say started really with the pandemic where there was that shared kind of experience. So that's just one challenge we're always mindful of is making sure that we're checking in and trying to help clinicians not experience that burnout and have the
Yeah.
support they need that's there. I would say some other challenges is really just kind of trying to be as able to financially support our clinicians and be able to provide as many benefits as possible when insurance rates have remained fairly stagnant or gone up very minimally over the years and costs continue to rise but insurance does not necessarily keep up with that. And so I think that's something we're just always battling, and we've gone back and forth on whether to be a self-pay practice or take insurance, but for us it really would limit access to care for so many people, so we've decided to stay with insurance. But it always adds just layers of complexity when you're dealing with
Yeah,
reimbursement. So I would
absolutely.
say those are probably like the two main challenges right now that we're constantly battling.
Yeah.
As far as goals for Bridgepoint for the next year, we are really dedicated to trying to continuously increase just pro bono access and also low cost services. So many of our clinicians are currently providing low cost therapy or pro bono services by choice. And we work with some organizations that actually pay for some services for clients that don't have access to insurance, which is great. So in this next year, we're looking for ways to expand that offering and hopefully be able to compensate our therapists for that pro bono work so that they're able to feel compensated for that time, but also open up access to the community more. And then we're always trying to increase just different offerings within the practice. So working on increasing our group offerings, which I think one allows for clients to feel that community support and be in the room with other people kind of going through similar life
Yeah.
experiences, but it also opens up a little bit lower cost option for support as well compared to individual therapy. So those are two areas that I think we're always looking at. And then lastly, just working to increase our training program. So we have taken on quite a few trainees for this next year, which we're really excited about so that we can hopefully kind of keep expanding the next generation of therapists and help them be able to support more clients that work with grief and loss and trauma. So those are some exciting changes in the next year.
That's amazing. I love that. When it comes to the group classes, are those in person or also online?
So currently we are running groups virtually, primarily because we've just found that access is a little bit
Yeah.
easier. We do have group space for in person, and that's something that we are hoping in this next year to offer kind of both. So some groups that are in person and some that are virtual, but currently our groups are virtual.
It just seems almost like that, or maybe that's just a personal thing, that it used to be such a thing, group therapy, and now it's almost everyone just has their own therapist. But I feel like especially in a new chapter like parenthood, that would be so beneficial because just the community and hearing from other moms like the struggles that they go through make you feel not so alone and less guilty, and you just judge yourself less, and it just really really helps hearing others kind of go through the same or similar problems. So that's beautiful that you offer that.
Yeah, I agree. I think it got lost a little bit during COVID because we
Yeah,
just weren't able to do it. And I think virtual groups are, emerging more since that time, but definitely when in person too. It's so nice. So I think trying to bring that back to being more of a norm for supplemental support is so important.
that's amazing. If there's one thing that you could change about like how society supports new parents, what would that be?
Do I get like a magic wand with no limit? Because I feel like, the wants would be kind of big. But honestly, I think for me, it would be just some level of universal support for moms that is expected. So, not only for moms that are maybe already in crisis or challenged, but support from like day one. So, whether that be in home support with like some form of like doula or a night nurse to help moms get sleep for the first couple weeks, or access to so many subsidized therapy sessions as like a normal part of
Mhm.
adjusting to motherhood. I think just some sort of built in support in those first few weeks would be so helpful just for moms to know like they're not alone and that whatever they're experiencing is normal and that
Yeah,
it's okay. I think would make such a difference.
absolutely. I love that. Thank you so much. That was amazing. Yeah, I appreciate all your insights. So, if someone was trying to either book a session with one of your therapists or would be interested in any of the group sessions, what would be the best way to get in touch?
Yeah, the best way would be to go to our website, which is just bridgepointpsychology.com. And we've got an info form on there where you can just fill that out and then we're able to get in contact. Or the direct email for that is just info@bridgepointpsychology.com. And we monitor that inbox and we can help get support started.
And then they usually get matched with the right therapist because you mentioned in the beginning that really that's what you focus on, right? Hyper specialized therapists. So, depending on what journey they've gone through, if it's been loss or postpartum depression or whatever it might be, you'll find them the right therapist.
Yes. So part of our process is that both myself and my managing partner, Dr. Adam Margel, we both manage all of the intakes currently. So we go through and really speak with new clients about what they're coming in for, do a little bit of a history background to see if there's anything we should know about. And then we match them to a therapist that would have the skills needed to kind of support any of the things that might come up in their journey.
All right. Thank you so much. I appreciate it. That was amazing. I'm sure it helped so many women out there to just feel heard and not so alone and hopefully go and get help. So, yeah, thank you for coming on the show.
Absolutely. Thanks for having me.